Thank you very much. And Savannah did a great job pulling this agenda together because as you can see here at the state, we're going to talk about safe infant sleep. And Barb and First Candle have been great in their community level efforts. We're going to talk about the prevention resources to support Texas communities to reduce SUID. So we play well off of each other. As many of you know, SUID deaths in the US rose to about 3,700 in 2022, and this is higher than previous year's estimates of around 3,400 deaths. 86% of these sleep-related infant deaths occurred in the first 5 months of life. And in Texas, SIDS is actually the third most common cause of infant mortality under 1 year of age. In Texas, we non-Hispanic Black infants are 2.5 more times more likely to die from SIDS than non-Hispanic white infants. The chart above shows the breakdown of SUID by cause in 2022. 41% were SIDS related, and that's 1,529 deaths. 31% were unknown cause, 1,131 deaths. And accidental suffocation and strangulation, or 1,040 deaths. I think it's important to know and start with this data. In Texas, specifically, I want to talk about who's most at risk. And this graph shows the infants per deaths per 10,000 live births and focuses on the leading cause of infant death by race and ethnicity. SIDS is indicated in the bright yellow bar, and non-Hispanic Black infants' rate of death because of SIDS is the highest. The blue arrow indicates that difference in rates compared to other population, and it's one of the areas of opportunity that we know we can move the needle to reduce infant mortality. Two common practices that are monitored through the Texas Pregnancy Risk Assessment Monitoring System, also called PRAMS, are mothers who reported placing their infants on an approved sleep surface and placing infants to sleep without loose bedding or soft objects. This slide shows responses by race and ethnicity. And I want to point out that there are disparities or gaps in this behaviors. Your non-Hispanic Black mothers are less likely to report placing their infants to sleep on an approved sleep surface, and both non-Hispanic Black and Hispanic mothers have are lower at reporting placing their babies to sleep without soft objects or loose bedding. In a lot of our work with community partners that we engage, we often hear that they want to learn more about their sleep-related infant deaths and the data that's significant to their community, localized. And I want you to know that DSHS supports 223 child fatality review teams across Texas. We have a directory that you can access to find your local CRFT team on the DSHS website and contact to get involved. So an effort was made to develop a new to Texas strategy. And this was based on pretty convincing data that overall in the last 20 years, we've really stalled in our efforts, but we've seen this major gap or disparity become more and more apparent. So we especially needed to bring new strategies to Texas to reach the populations that show higher rates of death. And how can we do that and reach more people? Here were some guiding factors. We recognize that each family's needs, beliefs, and context within their lives are important. choose an individualized approach to promoting safe sleep and increasing the likelihood of behavior change. We recognize that you have to integrate breastfeeding and safe sleep that mutually affect one another. And we have to have those conversations with caregivers and parents to shift their view from you as an expert to you as a supporter and problem solver. So developing a circle of support within a community was a high priority. And that provides consistent messaging and alignment of messaging from multiple sources, multiple times. We also recognized through our efforts that we needed to normalize the newborn behaviors and the expectations so that parents are better positioned to manage feeding, crying, sleeping, and all of the overwhelming patterns. So in 2022, we led at the agency, had a literature review, and the team engaged in qualitative research and a development process that was supported by some national experts to help us build out a health promotion campaign and educational resources to support that. In 2024, DSHS piloted the strategy for implementation and tools for the community trainings with both urban and rural settings here in Texas, up in North Texas and all throughout our rural communities. Just in case you're wondering, everything is bigger in Texas. If you're not from here, our state comes with a lot of size. About 11 small states make up our public health regions and diverse definitions of what community means throughout the state. So the agency and our team took a continuous quality improvement approach to develop the strategies and materials to make them accessible and responsive for our partners. This year, we're scaling up this strategy across the state with 11 of our public health region, our 11 public health regions and partners in 8 metropolitan communities where we have Healthy Texas Mothers and Babies coalitions. So some of the key resources that were developed through adaptations and expansions relied on the 2022 update from the AAP, both their technical report and recommendations, our partners at the National Institute of Child Health and Human Development and their Safe to Sleep campaign, the Building on Campaigns Through Conversations, originally developed by the NAPS Coalition, and a project that is overseen by Dr. John Richards at the National Center for Maternal and Child Health Education at Georgetown, and then baby behavior training originally developed for California WIC, and Dr. Jane Hennig, the Executive Director of Human Lactation Center at the University of California, Davis. We really appreciate their time and commitment in reviewing and working with us. So our approach to the toolkit and developing resources that are free for Texas communities to get this conversation started and build out the systems and strengthen the supports was really about aligning messaging across communities and organizations. And then those community organizations going back and working with their educators, which that secondary level are the boots on the ground. And those educators then have that primary influence with our parents and caregivers. And we firmly believe that this is not a discussion that's had just with parents, but anyone caring for an infant in Texas. So some of the resources that we developed to support are a community training, and then we adopted the Clear the Crib awareness activity and created resources for communities, and then updated originally a parent and caregiver class to align messaging across different platforms, no matter what capacity level your organization within the community had. So in the community training, this is a training of the trainer. It is, again, that awareness piece, that beginning for that acceptance of this conversations-based approach in an organization, to make sure that that message alignment happens no matter if you are at applying for housing, going to a new healthcare provider, going to a WIC appointment, that the communication is consistent across organizations. And then we have within our community training, I wanted to share, there are resources online for English and Spanish, a variety of tools that meet unique needs in our diverse community. And we're going to have some new implementation videos in late spring to support partner organizations that may not be able to connect with a training or are interested in how to use promotional items. You can also visit our table. There are a lot of the resources we brought with us today for you to touch, feel, and engage with us in. So I want to point out a couple of key elements of the half-day community training. And the very first thing that was piloted and actually revised just this year, and I'll share those revisions in a few slides, but the first element is really strengthening that community circle of support. And this is where Barb and I we've talked ahead of this and together about how the state level approach really supports that community organization implementation of the First Candle efforts. And one of the elements of strengthening support is identifying areas where non-medical drivers of health, right? Non-medical drivers of health impact how often, when this message is heard, if this message is consistent, and drives the ability to meet parents where they are. So one of the big elements that we support is in implementation mapping your community, identifying, do we lack access or resources to something? And then as a community coming together and solving that problem instead of just leaving it as a blank open spot, a hole that parents fall into. So implementation through strengthening a community circle of support, leveling the playing field. When you bring everyone together and you're using a train the trainer model, not everyone's a trainer. And so having some tools and resources just to build on best practice, resources debunking myths and supporting facts, and then self-reflection, and really just taking a moment, taking stock over time and repeatedly of how you enter into the work that you do with families. And then using a teach back and practice method with those that are there for a train the trainer session. So one of the elements and you'll see throughout the campaign, all of the 2022 AAP recommendations are outlined using icons that are easy to understand throughout the toolkit, between infographics to memory games, to support easy identification of those recommendations. But additionally, and you can see them now, run through, all the topics are included in discussion guides and infographics, a parent caregiver class, and we expanded on that. So we have feeding cues, crying, and sleep. And in feeding cues, crying, and sleep, we're trying to address those concerns that parents express and often contribute to why unsafe sleep practices occur. So breaking down the norms and trying to get ahead of that in education and prevention efforts. Additionally, we found that we needed to talk about sleep training common questions about emergency situations and special health conditions. So the tools that were developed and are available online for any partner to take down, utilize, adapt are infographics, a 20 part discussion guide that on the front is really designed for parents. We've talked about the why is there. Clearly in plain language that's easy to understand and easy to reference other topics that may contribute to, for instance, breastfeeding, which is on the screen. On the back, we provided common family and caregiver concerns and how to address those using plain language to support our partners' knowledge, understanding, and efforts in having conversations. Additionally, when parents and caregivers are adopting a behavior for safe sleep practice, it can be hard, and we know that. And one of the elements of prevention is planning for the unknown, kind of talking through everything, coming up with those scenarios, identifying the barriers that exist ahead of time. And so there is a plan available to use as an editable PDF or resource just to guide a conversation that goes through all of the recommendations and identifies where parents need more information, what they find hard, and may need additional support to adopt in that behavior or recommendation, and then to identify their unique plan. One of our 2024 revisions that came from our pilot evaluation that I mentioned a few minutes ago was really users identifying this concept of circle of support based on the circle of care model. And this circle of support tool was split, one for community mapping and then one for an individual effort and resource in conversations with parents. And this directly using this map or tool with parents is an easy visual that allows that person to help parents find their unique circle before birth, around birth, after birth, and beyond in the first year that can help them and that are caring for their baby. So we appreciate our pilot partners in identifying and adapting. Additionally, DSHS has templated materials like this community resource template that provides national and state level resources available to all Texans, along with an area for each community or organization to add local level information and contact to support their unique efforts in their community. So the tagline that was developed as we moved through this campaign, every caregiver can plan for safe sleep every night, every nap, every feeding, every time. It indicates that information isn't just for parents. We encourage everyone to bookmark the site, share information with anyone who cares for an infant, and stop by and see us at the table. We've got a little follow-up activity that came out of our piloting that we'd love to interact with you with. The efforts that we made in developing these materials were really to sustain long-term health promotion in preventative behaviors and resources that we could use in our large state. So I thank Dr. Les for having us, and we'll take questions at the end.